Cholera is an infectious disease that has affected humans for centuries. However, it was first identified as a distinct medical condition in 1817 during an outbreak in the Bengal region of India, which is now part of present-day Bangladesh and India. British physician John Snow is often credited with discovering the link between cholera and contaminated water in the mid-19th century, during the 1854 London cholera outbreak. Snow's work on cholera established the importance of sanitation and clean water supply in preventing the spread of the disease. Cholera is an infectious disease caused by the bacterium Vibrio cholerae. The primary route of infection is through the consumption of contaminated water or food. When a person ingests the bacteria, it can multiply in the small intestine, producing a toxin that leads to severe diarrhea and dehydration. Here are the main ways through which cholera can be transmitted. Contaminated water. Drinking water contaminated with Vibrio cholerae is the most common route of infection. The bacteria can contaminate water sources when human fecal matter from infected individuals enters the water supply, often due to inadequate sanitation and sewage disposal systems. Contaminated food. Consuming food that has been prepared with contaminated water, washed in contaminated water, or handled by an infected person can lead to cholera infection. Common examples include raw or undercooked seafood from contaminated waters, fruits and vegetables washed with contaminated water, or food prepared by an infected person who did not practice proper hygiene. Direct contact. Although less common, cholera can also be transmitted through direct contact with fecal matter from an infected person. This can occur when caregivers or family members handle the feces of an infected person without proper hygiene practices or when individuals come into contact with contaminated surfaces. Proper sanitation, safe water supply, and food safety practices are crucial in preventing cholera outbreaks. In areas with poor sanitation or during outbreaks, measures like boiling or treating drinking water, washing hands with soap, and cooking food thoroughly can help reduce the risk of infection. Cholera is an acute diarrheal illness caused by the bacterium Vibrio cholerae. The primary symptoms of cholera are related to its effect on the gastrointestinal system. Symptoms can range from mild to severe, and some infected individuals may show no symptoms at all. When symptoms do appear, they typically occur within 2 to 3 days of exposure to the bacteria. The main symptoms of cholera include severe watery diarrhea. Cholera is characterized by sudden onset of profuse, watery diarrhea that is often described as having a rice water appearance. The large volume of fluid loss can lead to rapid dehydration. Nausea and vomiting. Infected individuals may experience nausea and vomiting, which can contribute to the loss of fluids and electrolytes. Dehydration. The rapid fluid loss from diarrhea and vomiting can lead to severe dehydration. Signs of dehydration include sunken eyes, dry mouth, decreased urine output, increased heart rate, low blood pressure, and lethargy. In severe cases, untreated dehydration can result in shock, kidney failure, and death. Muscle cramps. Cholera can cause muscle cramps due to the depletion of electrolytes, such as sodium, potassium, and chloride, which are essential for normal muscle function. Abdominal pain. Some individuals with cholera may experience abdominal pain or discomfort due to the irritation of the gastrointestinal tract. Prompt and appropriate treatment is crucial to prevent complications and reduce the risk of death from cholera. Treatment primarily involves oral rehydration therapy to replace lost fluids and electrolytes. In severe cases, intravenous fluid replacement and antibiotics may also be necessary. The treatment of cholera primarily focuses on addressing the dehydration and electrolyte imbalances caused by severe diarrhea. Prompt and appropriate treatment can significantly reduce the risk of complications and fatalities. The main components of cholera treatment include oral rehydration therapy, ORT. This is the cornerstone of cholera treatment. ORT involves the administration of a solution containing water, salt, and sugar to replace lost fluids and electrolytes. The World Health Organization, WHO, recommends using oral rehydration salts, ORS, packets, which contain the precise amounts of salts and glucose needed for effective rehydration. ORS packets are dissolved in clean water and consumed in sufficient quantities to compensate for fluid loss. Intravenous, IV, fluids. In severe cases of dehydration, oral rehydration may not be sufficient or feasible. In such cases, intravenous fluid replacement may be necessary to rapidly replenish fluids and electrolytes. Ringer's lactate or normal saline solutions are commonly used for this purpose. Antibiotics. While rehydration is the primary treatment for cholera, antibiotics can be used in conjunction with rehydration therapy to shorten the duration and severity of the illness. Antibiotics help reduce the amount of bacteria in the intestines, which in turn reduces diarrhea volume and duration. Common antibiotics used for cholera treatment include doxycycline, azithromycin, and ciprofloxacin. The choice of antibiotic may depend on the local antibiotic resistance patterns of Vibrio cholerae. Zinc supplementation. In children with cholera, zinc supplementation has been shown to help reduce the duration of diarrhea and improve the overall outcome. Supportive care. Supportive care, such as maintaining nutrition and addressing any other coexisting medical conditions, is essential during cholera treatment. The patient should be monitored for any signs of complications or worsening of the illness. Prevention is critical in controlling cholera outbreaks. Measures like improving sanitation, providing safe water sources, practicing good personal hygiene, and proper food handling can significantly reduce the risk of cholera transmission. Additionally, cholera vaccines are available and can be used in high-risk areas or during outbreaks to help prevent the disease.